Also today, notices have started going out to employees at the U.S. Health and Human Services Department. This is part of cuts announced by Health Secretary Robert F. Kennedy Jr. just last week. This was the scene outside of the department building this morning. An FDA employee told ABC News staff were told to present their badges at the building entrance, and those who were fired were given a ticket and told to return home. The cuts are part of a broader plan by the Trump administration to reduce staffing levels in federal departments and agencies. So we told you last week how 10,000 people are expected to be laid off. Well, that is on top of another 10,000 who left voluntarily, shrinking the health department workforce from 82,000 to 62. And today I spoke with a local doctor about what this could mean for Western New York and our healthcare system.
And the big thing is, what is the restructuring going to accomplish?
Dr. Nancy Nielsen from the Jacobs School of Medicine at the University of Buffalo says she is very familiar with how the Department of Health and Human Services operates. She used to work there.
I did. I was on loan to the federal government for 2 years during the Obama administration.
So when you heard everything that Robert F. Kennedy Jr. is planning to do, what's your reaction?
Well, first of all, restructuring of HHS is not new. That's happened a number of times. The difference here is he's cutting a significant proportion of the workforce, 20,000 people.
Secretary of Health and Human Services RFK Jr. says he is making those cuts to make the agency more efficient.
HHS is a sprawling bureaucracy that encompasses literally hundreds of departments, committees, and other offices. When I arrived, I found that over half of our employees don't even come to work.
When he says that there are more than 100 communications offices, more than 40 ID departments, and 9 HR departments, your reaction?
Absolutely true. Absolutely true. I mean, there's no question that there can be streamlining and efficiencies. But if we can get a focus on prevention in a way that we have not, that would be great. But what we can't do is deny that measles vaccine would stop the spread of measles.
She says she's also concerned about some funding cuts.
And already there have been millions of dollars of grants lost at the University at Buffalo and other places.
RFK Jr. says he is working to save taxpayers' money and improve services.
We are the sickest nation in the world, and we have the highest rate of chronic disease. The U.S. ranks last among 40 developed nations in terms of health, but we spend 2 to 3 times more per capita.
So I think we just have to not wring our hands, be very vigilant, and call out things when we see them that aren't going right, and try to work with them where we can.
And she also says in the nursing school, a grant was terminated a year and a half early, she says, because it was being used to look into the mental health of marginalized teenagers, including LGBTQ.